Welcome to Chapter 8, Teamwork and Collaboration. The objectives for Chapter 8 are to explain the role of teams in healthcare organizations, describe the importance of effective teams to patients and staff members, evaluate the impact of organizational culture on team success, identify characteristics of effective teams, understand the concept of groupthink, and evaluate how peer review and teamwork help bring about better patient care. It is standard practice for healthcare organizations to use teams. Dedicated clinical teams administer patient care, and management teams develop and implement a healthcare organization's strategy, rules, and protocol, all with the goal of improving the healthcare system and the delivery of healthcare services. In the 1900s, physicians initiated the use of teams as a strategy for communicating about the patient. And by the 1930s, nurses, via their state associations, officially supported the team approach to coordinating patient care. Interdisciplinary healthcare professionals continued to endorse the use of teams in clinical practice. And by the end of the 20th century, the Joint Commission had mandated that patient care plans document interdisciplinary input and included teamwork as one of its corporate values. Teamwork climate refers to how well the healthcare team members perceive they work together to provide patient care. Surveys may be used, such as a climate survey, and those are used to assess and help determine the degree to which they work well together. Research supports better climate, better patient outcomes. It is the healthcare manager's responsibility to help shape an organizational culture that allows for effective teamwork. Organizational culture may be analyzed at three levels. 1. Visible artifacts. 2. Espoused beliefs, values, roles, and behavioral norms. And 3. Tacit, taken for granted, basic underlying assumptions. The term visible artifacts refers to what you can see, such as the uniforms worn by various staff members in a healthcare setting, the layout of the nurses' station on hospital floors, or the appearance of patient waiting rooms in a clinic. Espoused beliefs, values, roles, and behavioral norms all refer to what employees learn about the organization and adopt as organizationally sanctioned. This does not mean all employees will accept these as their own beliefs, values, or norms, but those who do not may risk excommunication from the group. And then the taken for granted or the unspoken expectations. As you learn about an organization's culture, you may see that these taken for granted underlying assumptions about the way employees conduct themselves, or what senior management considers important regarding employee behavior, and how work is actually done can help you predict how the organization may respond in future circumstances. Assessment surveys can ask questions pertaining to subjective opinion about how the team is working together, such as, do you help each other? Do you understand the roles of the other team members from other professions? Do you have confidence in each other's abilities? Do you communicate freely with one another? And do you share responsibility for actions made by the team? Team effectiveness depends on how well team members work together. There are several stages of team development and behavior. These stages are forming, storming, norming, performing, and then adjourning. The forming stage is an orientation phase in which members are given their charge or purpose for the team. During this stage, team members learn about one another's personalities. The storming stage is characterized by conflict and emotional issues that may inhibit a team's progress towards performing the task with which it was charged. How effectively or not team members learn to work with one another depends on their personalities. If the team is able to move forward, it will experience the norming stage. In this stage, team members agree upon working style and make compromises. Conflict is reduced as the team unifies. The energy that has been directed toward the conflict is now devoted to the charge of patient care. Then the team enters the fourth stage, performing, and they work productively together. The final stage is adjourning, during which the team goes over its successes and individuals disengage from the team. Leadership in teams may be authoritarian in style, laissez-faire, or democratic. Authoritarian is a leadership style in which power is concentrated in the leader. Laissez-faire is a hands-off leadership approach, and democratic is a leadership approach in which the team members share governance. Conformity to group values and ethics that may lead to negative outcomes regarding patient care is what is termed groupthink. Healthcare managers who rely on team output need professional staff members who understand why the team was formed, allow for respectful, open communication among team members, share leadership, deal with conflict effectively, and evaluate team performance on a regular basis. Healthcare managers may help by clearly defining the team goals, and the team then should adhere to the following best practices. Determine the best way to attain goals. What protocol may help the patient improve? Agree on team norms. How team members will collaborate and communicate with one another. Advocate shared leadership for interprofessional teams. Assign specific team member functions. Hold regularly scheduled meetings. Handle conflict with team members directly, but seek assistance from the supervisor if internal mechanisms do not work. Evaluate team performance on a regular basis, addressing the team's strengths and weaknesses. Healthcare managers provide a positive environment, intervene as necessary to help solve problems, and evaluate team performance. As a result, the team members are supported so that they may work to restore the body and empower the spirit. Points to remember. Teams have an important role in providing quality patient care. The Joint Commission has mandated interdisciplinary input and included teamwork as one of its corporate values because of the relationship between effective teamwork and patient outcomes. Organizational culture affects teamwork climate, which in turn affects patient care. Healthcare professionals who experience effective teamwork report better job satisfaction. Groupthink may yield negative outcomes for the team members as well as for the patients. Too much conformity to group values and ethics may lead team members to fail to consider alternative ideas. Effective teamwork results from a culture that supports open communication among team members, that is respectful yet can deal with conflict effectively.